Welcome back to the deep dive. Today, wow, we've got quite a mix of source material from Southern California.
We really do.
It ranges from community reclamation, really powerful stuff, to these urgent policy threats we're seeing. And then there's this massive corporate accountability lawsuit.
Yeah, this stark contrast, isn't it? You see this local push for unity, almost like building something up,
Right.
and then these national level, well, potential roadblocks or threats to safety nets.
So, our mission today.
Let's extract the key facts, the critical connections for you. We'll go from a very specific local story, Bakersfield, all the way up to federal policy debates, and then land on this huge disaster recovery effort.
And show how it all intersects. History, policy, disaster. It's all happening right now.
Exactly. You'll really see how local efforts to create security are bumping up against these bigger political currents.
Okay, let's dig in. First stop, Bakersfield, California. This one really stood out, the grand reopening of the historic Woolworth building back on October 25th.
It's a really significant event for that community, a landmark moment.
It really is. And this isn't just, any old building they fixed up. It actually houses the last standing Woolworth lunch counter in the entire U.S.
Wow, the last one.
The last one. And you feel that history. I mean, these counters, nationally, they were such potent symbols of exclusion during segregation, denying service, making people feel unwelcome.
Right. Even if Bakersfield didn't make the national headlines like Greensboro, that daily reality of exclusion was there.
Absolutely. But what's so interesting here, what the sources show, is how the community is flipping that narrative.
Taking that painful history and consciously repurposing the space. Dr. Gregory Tatum, he's the pastor of Change Community Church, really connected the dots at the reopening.
Yes.
He linked it directly back to the national civil rights struggle. He reminded everyone about those 4 brave black college students, the Greensboro sit-ins, 65 years ago now.
Which led to SNCC, the Student Nonviolent Coordinating Committee, a huge moment.
Exactly. And Dr. Tatum went even deeper, tracing it back to Plessy v. Ferguson in 1896. The whole separate but equal doctrine that underpinned segregation for decades. He pointed out how that system was fought, literally, by people sitting down, refusing to accept those boundaries.
So this reclaimed space, the message is really clear. Everyone gets a seat. That's what the co-owner, Emily Waite, said.
Yeah, she called the restoration a love letter to Bakersfield.
Nice.
The goal is a vibrant place for connection. It's got a luncheonette, Reverb Coffee, an event space downstairs.
Making it a real community hub now.
And you could feel that at the event, apparently. It opened with Lift Every Voice and Sing, performed by a community choir.
Powerful.
And there was this gripping original piece by a spoken word artist, Keen DeVar, really channeling that history, the struggle, but also the resilience. It's history being transformed, not just, put in a museum.
It's a beautiful example of what local unity can achieve, but now we have to pivot, unfortunately, from that feeling of building up.
To what national gridlock threatens to tear down.
Exactly. The safety nets. We need to talk about the looming threat of a federal government shutdown.
Yeah, this is immediate and it's complicated. If Congress doesn't get funding sorted out and a shutdown goes past November 1st, well, critical programs are at risk.
Let's focus on Head Start first. What are the stakes there?
Okay, Head Start. We're looking at 134 programs potentially losing operational funding. That's across 41 states and Puerto Rico. It affects over 65,000 kids.
65,000? That's huge. Is anyone trying to prevent that?
Congresswoman Maxine Waters introduced a bill, the Head Start Shutdown Protection Act. The idea is basically to reimburse states or local governments if they step in and use their own money to keep these programs open during a shutdown.
Trying to keep the doors open, keep kids learning, no matter the D.C. drama.
Right. Keep the impact away from the children if possible.
And then there's food assistance. SNAP or CalFresh here in California. That impacts millions.
It does. SNAP benefits are set to run out in November if the shutdown happens. Nationally, that's about 42 million Americans. Here in California, it's about 5.5 million people.
So what's the state plan?
Governor Newsom announced they deploy the California National Guard, along with state volunteers, to actually distribute food, to try and fill that gap.
Wow. Calling in the Guard for food distribution, that shows the potential severity.
It really does.
Okay, the politics of this. How are leaders framing this? Who's blaming whom in the sources? It must be intense.
Oh, it is. According to the reports, House Speaker Mike Johnson labeled it the Democrat shutdown. He's quoted alleging Democrats are using it as leverage for other demands.
Like what?
Things like extending Obamacare subsidies permanently or restoring health care for undocumented immigrants.
And the Democratic response.
Leaders like Hakeem Jeffries push back hard, saying those issues aren't tied to keeping essential services like SNL2 funded. They argue these safety nets need to be protected regardless.
So for you, the listener, the takeaway is...
The political finger-pointing is happening, but underneath it, real support systems for kids and families are genuinely at risk.
Okay, so a potential shutdown isn't the only cloud. There are also big changes coming to Social Security itself.
That's right. Several things are happening. First, the age for full retirement benefits is going up. If you were born in 1960 or later, it's now 67.
Okay.
Also, they're phasing out paper checks. That hits about 5 million people, often older folks or those without bank accounts.
That could be a real hurdle for some.
Definitely. And maybe the biggest one? The rules around disability are getting tighter, significantly tighter.
This brings up that theme again, doesn't it? Who gets a seat? Who gets security? You mentioned the history of Social Security earlier.
I did. And Professor John C. Dubin from Rutgers Law highlighted this. The original act, way back, deliberately excluded jobs mostly held by black workers like agriculture and domestic work.
Right.
Partly, he argues, to maintain the existing economic structure, particularly in the South. And that legacy, well, it lingers. Today, black retirees get about 19% less in benefits on average than white retirees. It links back to lower lifetime wages, sometimes shorter working lives, even shorter life expectancy impacting benefits.
So raising the retirement age just makes that existing gap worse.
It likely has what Dubin calls a foreseeable racially disparate impact.
Yes. And the disability rule changes. You said they could be the largest cuts ever?
Potentially. We're talking about changes that could slash eligibility for Social Security disability insurance, maybe by as much as 20%.
How does that work? What exactly are they changing? It sounds complicated.
The core change targets older workers, generally those over 50. It removes age as a significant factor when deciding if someone can adjust to other kinds of work.
Okay, explain that, like if you're a construction worker.
Exactly. Think of a 58-year-old who's done heavy manual labor for 30, 40 years. Their body is worn down. Before, their age and inability to easily switch to, say, a desk job would be heavily considered.
But
Now, the new rule basically assumes they could learn a sedentary job, making it much harder to qualify for disability, even if their relevant work experience is all physical.
wow, that seems tough.
It's expected to hit hardest in regions with more manual labor jobs, like the South and Midwest.
It's really striking to see that parallel, from fighting for a seat at a lunch counter in the 60s to today's fight over who qualifies for disability based on rules that might disproportionately affect black workers and older workers in physical jobs.
Yeah, the historical thread is there, how past disparities get kind of baked into current policy mechanisms, sometimes unintentionally, sometimes maybe not.
All right, let's shift gears again. Health coverage. Another area facing major federal policy threats. There's this proposal, sometimes called the One Big Beautiful Bill Act. What's the potential impact there?
This one's aimed squarely at reshaping healthcare financing. We're talking about cutting federal Medicaid funding by around $800 billion.
$800 billion.
Yeah. That massive cost shift forces states to pick up the slack, which usually means tighter eligibility rules. Fewer people qualify.
And what about people who buy their own insurance?
The marketplace subsidies, the things that make those individual plans affordable for many people, those are also on the chopping block in this proposal. They'd be rolled back.
So taken together, what's the predicted outcome?
Dr. Melissa Clark, she is a public health physician cited in the sources, estimates over 16 million people could lose access to health care altogether, either kicked off Medicaid or priced out of the marketplace.
16 million. That's staggering.
And you see the immediate human cost. The source mentioned Mia Gardner, a painter, a freelancer in LA.
Right, I remember that.
She looks for a plan. The cheapest is almost $500 a month. She can't afford it, but she earns just a bit too much for medical.
So she's stuck in the middle.
Exactly. And she started rationing her asthma inhalers. That's the reality for people caught in that gap.
Rationing asthma inhalers. That really puts a face on an $800 billion cut, doesn't it?
So, okay, faced with these kinds of threats, what practical steps can people take? What did Dr. Clark suggest?
She stressed there are still local lifelines. First big one, community health centers.
Okay.
These are federally funded. They see patients on a sliding scale based on income. For some, it can mean zero out-of-pocket costs. They often have social workers, specialists too. A really vital resource.
What else if you're facing high costs or losing coverage?
Look into medication assistance programs. Websites like needymeds.org can help, Or sometimes drug manufacturers have discount cards, especially for chronic conditions.
Good tip.
And importantly, if you do get a notice saying you're losing Medicaid or Medi-Cal, appeal it immediately.
Why?
Sometimes it's just a paperwork issue, something got lost. An appeal can fix that. And finally, don't be afraid to negotiate hospital bills, even if you don't qualify for official charity care. Hospitals might prefer getting something rather than nothing.
Okay, really practical advice there. Let's make one more major shift. From policy debates to the aftermath of a disaster and corporate accountability. This brings us to the Eaton Fire lawsuit.
Right. This involves the NAACP and the law firm Singleton Schreiber suing Southern California Edison.
Over the Eaton Fire in Altadena? That was January 2025, right?
Yeah.
A truly catastrophic event.
Absolutely devastating. Over 14,000 acres burned. 19 lives lost. Thousands displaced. And Altadena itself is significant, a historic community, large concentration of Black Californians.
And the core of the lawsuit, the allegation against Edison, I read this, it sounds almost unbelievable, sparks from decommissioned equipment. That's the central claim. Failure to maintain and inspect a power line that hadn't even been used for over 50 years.
50 years?
Yeah. And it was in an area already flagged as an extreme fire risk zone.
The scale of the destruction is hard to grasp. What were the numbers?
Over 9,000 structures damaged or destroyed. That includes 6,000 homes, hundreds of businesses, small apartment buildings. The total estimated loss is somewhere between $10 and $12 billion.
Billion with a B. Just astronomical. So for the families who lost everything, what does this lawsuit mean? Especially, what about people who didn't have insurance?
That's a crucial point. About a quarter of the homeowners affected were uninsured. Maybe they'd paid off a house, maybe couldn't afford the premiums.
Right.
The lawsuit structure allows them to seek full recovery for their losses, too, not just insured homeowners.
That's huge for them. What's the timeline looking like?
Well, the trial is currently set for January 2027. But the lawyers are pushing hard to move that up, maybe to September 2026, hoping to get mediations and potential settlements happening sooner.
What are the immediate hurdles for the community trying to rebuild now?
Cleanup is mostly done, which is good, but rebuilding is slow. There are labor shortages,
Why is that?
partly linked to immigration enforcement actions happening at construction sites, apparently. It's slowing things down
Right.
and also driving up costs.
Another layer of difficulty. What about the mental toll?
This is important. The law firm is helping uninsured clients get therapy on a live basis, meaning the therapy provider gets paid later out of any eventual settlement or award from the lawsuit. So people can get the mental health support they need now without having to pay up front when they've lost everything.
That's a really vital service, a sign of hope amid the legal battle.
Exactly. Gerald Singleton, the managing partner of the firm, made a point of saying, look, this community will be largely rebuilt. The lawsuit is the tool to make sure the money is there to do it.
Wow. What a journey through these sources today. We literally started with reclaiming a segregated lunch counter as a symbol of unity.
Right, where everyone gets a seat.
Then navigated these really scary policy decisions, threatening food access, health access for millions.
Yeah, the potential shutdown, the Social Security changes, the health insurance rollback.
And ended with this massive, multi-billion-dollar legal fight demanding accountability after a devastating fire.
And when you lay it all out like that, you really see the connections, don't you? How these big systemic things, historical inequality, political gridlock, they directly impact people's lives during immediate crises. Shutdowns, fires, policy changes.
It's a lot to take in.
It is. But seeing those connections clearly, understanding how local action, legal action, policy debates all fit together. That's the difference between just feeling overwhelmed by it all and being informed. Knowing that things are happening, people are pushing back, building, demanding accountability.
So let's leave you, our listener, with this thought. We started with that Woolworth's counter, a physical place, a symbol of segregation, being transformed into a symbol of unity. Everyone gets a seat. Now, thinking about everything else we discussed, the policies threatening health, income, housing, often hitting vulnerable groups the hardest. What does reclaiming justice look like today? Not just in a building, but in our laws, in our courts. What does ensuring everyone gets a seat mean in those arenas? Something to mull over.